Dr. Marcus Webb moved through the field hospital with practiced efficiency, his mind tracking multiple patients simultaneously while his hands worked on whoever required immediate intervention. 12 years of humanitarian medical work in conflict zones had taught him to operate in conditions that would paralyze doctors trained in stable, well-equipped facilities. The current situation was brutal even by his standards. Major engagement 6 hours ago between Korathi Empire forces and the Sailan Federation, a grinding territorial dispute that had been simmering for years and recently exploded into open warfare. Casualties were flooding into his field hospital faster than his team could process them. Marcus worked for the Interspecies Medical Relief Coalition, a neutral humanitarian organization that provided emergency medical care in war zones regardless of which side the wounded belonged to. They operated in the messy borderlands where species clashed over territory, resources, or grievances so old that neither side could quite articulate what they were still fighting about. His current field hospital sat in nominally neutral territory, treating anyone who could reach their position. Today that meant a chaotic mix of Korathi soldiers with catastrophic injuries, Sailan fighters barely alive, and civilians who'd had the misfortune of being too close to strategic positions when the fighting started. Dr. Webb, one of the triage nurses, called out, "Critical incoming to OR 3, priority flag from the transport team." Marcus finished securing the arterial clamp he was placing and transferred his current patient to post-operative monitoring. "What's the situation?" "Korathi female, significant torso trauma, critical blood loss, conscious but disoriented. They're prepping her now." Marcus scrubbed out quickly and headed for operating room 3, actually just a section of tent separated by hanging plastic sheets, but it had the best surgical equipment they possessed and his most experienced team. The patient was already on the table when he arrived, his team moving with coordinated precision to establish IV access, monitor vitals, and prepare for emergency surgery. Marcus assessed the situation with the kind of rapid calculation that had become second nature. Female Korathi, maybe 35 standard years. Significant trauma to left torso and abdomen. Blood pressure dangerously low despite aggressive fluid replacement. Consciousness fluctuating but present. Standard combat injuries requiring immediate surgical intervention to control internal bleeding and repair damaged organs. He scrubbed in while reviewing the preliminary scans his team had already obtained. Liver damage, possible splenic injury, significant vascular trauma. Challenging surgery even in ideal conditions. In a field hospital with limited resources, it would test the absolute limits of what was possible. But this was what Marcus did, what his team did. They'd performed miracles under worse conditions. "Anesthesia status?" he asked as he approached the table. "Maintaining consciousness for now per protocol," his anesthesiologist replied. "Patient is stable enough for your pre-op briefing, but we need to proceed immediately after." Marcus positioned himself where the patient could see his face clearly. It was his standard protocol before any surgery, even emergency procedures. Introduce himself to conscious patients, provide reassurance, establish human connection before the clinical necessity of cutting them open. The patient's eyes were unfocused with pain and medication. Her elongated ears, characteristic of Korathi physiology, positioned in what Marcus recognized as distress even through his limited cultural knowledge. "I'm Dr. Marcus Webb," he said clearly, making sure she could hear him through the pain and confusion. "I'm going to be performing your surgery. My team is excellent. We've treated hundreds of casualties from both sides of this conflict. You're in good hands. We're going to do everything possible to save your life." It was the same introduction he gave everyone. No rank beyond doctor, no organizational affiliations beyond the implied neutral medical service. Just his name and professional reassurance that she was receiving the best care they could provide. The patient went completely still. Her ears moved to a position Marcus didn't recognize from his basic Korathi cultural training, something between shock and recognition. Her eyes, which had been unfocused moments before, suddenly locked onto his face with laser intensity that seemed impossible given her injuries and the medications they'd administered. "Marcus Webb," she repeated, her voice rough but carrying something that sounded like profound recognition. "Taravesh Field Hospital, 7 years ago." Marcus paused, surgical instruments ready, trying to place the reference. Taravesh. 7 years ago. He'd worked a rotation there during a different conflict, brutal fighting between Korathi forces and local insurgents, but he'd treated hundreds of people during that deployment. Specific patients from that long ago blurred together in memory unless something particularly unusual had happened. "I may have treated you previously," Marcus said carefully, professional but noncommittal. "Right now, I need to focus on treating you in the present. You have significant internal injuries requiring immediate surgical intervention. I'm going to proceed unless you have specific objections or concerns I should address first." The patient made a small gesture with her hand, difficult movement given her injuries, but apparently important enough to attempt despite the pain. One of Marcus's nurses, a Korathi woman named Sarith who worked for the Neutral Medical Coalition, made a quiet sound of shock. "Doctor," Sarith said urgently but quietly, "I need to speak with you immediately, outside the surgical field." Marcus caught something in her tone that suggested this wasn't medical concern. This was something else entirely. He stepped back from the table, letting his team maintain patient stability while he moved to the corner of the tent where they could speak without the patient hearing. "What's the problem?" he asked. Sarith's ears were expressing what Marcus had learned to recognize as profound shock mixed with concern. "That's Queen Sarith, ruler of the Korathi Empire. She was traveling with a military convoy that got hit by Salen forces 6 hours ago. Her security detail fought a desperate retreat to get her to the nearest medical facility, which happened to be our position." Marcus felt his stomach drop. The Korathi Empire's ruler, bleeding out on his operating table in a field hospital that ran on donated supplies and volunteer staff. "Does she want different treatment?" he asked practically, his mind already running through logistics. "Transfer to a Korathi military hospital. I can stabilize her enough for transport if she'd prefer treatment from her own people in a better-equipped facility." "She recognized you," Sarith said. "She spoke your name and mentioned Taravesh. Doctor, do you remember what happened at Taravesh 7 years ago, specifically?" Marcus tried to pull details from a deployment that blurred together, with dozens of others. "I treated casualties, both military and civilian, Korathi forces and insurgents when they'd accept treatment from neutral services. There was—" He stopped, a specific memory surfacing through the fog of 7 years and hundreds of other emergency situations. "There was a siege," he said slowly. "Korathi military compound surrounded by insurgent forces. They had wounded inside, soldiers and civilians who'd taken shelter there. The insurgents said they'd allow medical personnel in to treat the wounded if we agreed not to provide intelligence about their positions to Korathi command. That violated Korathi military protocol," Sarith said. "Their command wanted intelligence about insurgent positions more than they wanted medical care for the trapped wounded. They ordered you to refuse the insurgent offer, told you to decline treatment rather than agree to those terms." Marcus nodded, the memory crystallizing with uncomfortable clarity. "But people were dying. The siege had been going 3 days. Wounded soldiers and civilians needed treatment urgently. So I accepted the insurgent terms, agreed to treat the wounded without providing military intelligence. Went into the compound with the supplies they'd let me bring. Treated everyone I could reach." "You saved 43 people that day," Sarith said quietly. 19 Korathi soldiers, 12 civilian refugees who'd been caught in the fighting, 12 insurgent fighters who'd been wounded during the siege. You treated all of them without regard for which side they belonged to. And you kept your word to the insurgents about not reporting their positions, even though Korathi military command threatened to revoke your operational permissions in their territory. She paused. Queen Sarith was one of the civilians in that compound. She travels incognito sometimes, goes to see actual conditions in contested regions rather than staged presentations. She got caught when the siege started. You saved her life 7 years ago, and she's apparently never forgotten the human doctor who chose to treat the wounded rather than follow political calculations. Marcus absorbed this, his mind simultaneously processing the information and the immediate medical necessity still waiting on the operating table. She recognized my name. She recognized you, Sarith corrected. You made a choice at Taravesh that apparently mattered to her. Now she's on your operating table again, and you didn't even remember her. I treated hundreds of people at Taravesh, Marcus said. I can't remember every individual patient from 7 years ago. That's probably exactly why she trusts you, Sarith said. You didn't treat her well because she was queen. You didn't know she was queen. You treated her well because she was wounded, and you believe wounded people deserve medical care. That consistency matters. Marcus returned to the operating table, his mind sorting through implications, while his professional focus remained on the immediate surgical necessity. Queen or not, she was a patient with life-threatening injuries who needed immediate intervention. Your Majesty, he said formally, acknowledging her rank now that he knew it. I need to proceed with surgery immediately. Your injuries are critical. Do I have your consent? Queen Sarith's eyes remained locked on his face. Despite her pain and the medications, her voice carried absolute certainty. You had my consent the moment you gave your name. 7 years ago at Taravesh, you made a choice. You prioritized treating the wounded over following political orders. You kept your word to insurgents even when it cost you professionally. You saved my life and 42 others, because you believed medical care shouldn't be conditional on politics. She paused, breathing carefully. I trust the doctor who made that choice. I trust Marcus Webb. My rank doesn't matter. Your integrity does. Proceed. The surgery took 6 hours. Marcus and his team worked with focused intensity that came from treating injuries that would kill the patient if any single step was performed incorrectly or any complication mishandled. Queen Sarith's injuries were severe. Internal bleeding from multiple sources, damaged organs, trauma that would be challenging even in a fully equipped hospital with unlimited resources. In a field hospital with limited supplies and equipment that was improvised, repaired, or jury-rigged to function beyond its original design specifications. It was surgery that tested the absolute limits of what was possible. But Marcus's team was excellent. They'd performed miracles under worse conditions. And they had one advantage that sometimes mattered more than equipment: the patient's complete trust. Queen Sarith didn't question their approaches, didn't second-guess their decisions, didn't demand alternative treatments or express doubt about their capabilities. She'd submitted herself to Marcus's care with absolute faith based on a choice he'd made 7 years ago on a different battlefield. When consciousness permitted, when pain broke through the medications, her ears expressed trust rather than fear. She'd recognized his name and decided that was sufficient. Everything that followed was detail. The surgery concluded successfully. Critical repairs made, bleeding controlled, damaged organs either repaired or removed depending on severity and replaceability. Queen Sarith was stable, transferred to post-operative recovery, where his team would monitor her continuously for the next 48 hours when complications were most likely. Marcus checked on his other patients. 3 more emergency surgeries while Queen Sarith was in recovery. 2 Salen fighters and 1 Korathi soldier who all survived because Marcus and his team refused to let battlefield politics determine who received care. 18 hours after Queen Sarith's surgery, when she was awake and stable enough for conversation, Marcus was summoned to speak with her privately. She dismissed even her personal guards, security personnel who'd survived the attack and reached the field hospital with her, to create actual privacy. "You didn't remember me," she said. "Not accusation, simple observation." "No, Your Majesty," Marcus admitted. "Not initially. I've treated thousands of people over 12 years in multiple conflict zones." Taravesh was one deployment among many. Individual patients from that long ago blur together unless something particularly unusual happened. "I apologize for not recognizing you." "Don't apologize," Queen Sarith said. Her voice was weak but firm. "That's exactly why I trust you. You didn't treat me well at Taravesh because I was queen. You had no idea I was queen. You treated me well because I was wounded, and you believe wounded people deserve medical care regardless of politics, rank, or nationality. That consistency is what matters." She shifted slightly, wincing at residual pain despite medications. "You made a choice at Taravesh that most doctors wouldn't have made. You prioritized medical necessity over political considerations. You agreed to insurgent terms that your own organization's sponsors found problematic. You kept your word even when Korathi military command threatened professional consequences. You demonstrated that your integrity wasn't conditional on who was watching or what rewards might follow. That decision saved my life. It also taught me something about the difference between political calculation and actual principle. You didn't know I was queen, but you treated me with the same care and respect you gave to wounded insurgents. That's remarkable." Marcus considered how to respond. "I just did my job, Your Majesty. Medical care based on need, not politics. That's the foundation of neutral humanitarian work. If I start making exceptions based on rank or political affiliation, I'm no longer providing neutral medical care. I'm just another partisan actor deciding who deserves treatment." "Most people say they believe that," Queen Sarith said. "Very few actually follow it when tested. You did. 7 years ago at Taravesh when following it cost you professionally. And today when you could have recognized my rank and changed your approach, but instead gave me the same professional introduction and standard care you'd give anyone." She met his eyes directly. "Thank you for your integrity. Thank you for being someone whose word and principles remain consistent regardless of who you're treating or what advantages might come from compromising those principles. That's rare and extraordinarily valuable." "You're welcome, Your Majesty," Marcus said. "Though I should clarify, I genuinely didn't remember you specifically from Taravesh. I remember the siege and the choice I made, but individual patients from that deployment blur together. I wish I could say I recognized you and your importance, but that would be dishonest." "That honesty is exactly why I trust you," Queen Sarith said. "You're not performing integrity for my benefit. You're not adjusting your behavior based on my rank. You're just being Marcus Webb, the doctor who treats the wounded based on medical need and keeps his word even when it costs him. That consistency is what I recognized when you gave your name. That's what I trusted when I consented to surgery. And that's what the Korathi Empire will remember." 3 weeks later, after Queen Sarith had recovered enough to return to Korathi space and resume her duties, Marcus received unexpected communication through official diplomatic channels. The Korathi Empire was substantially increasing its funding for the Interspecies Medical Relief Coalition. The funding came with specific provisions. It could not be tied to preferential treatment for Korathi casualties, could not be conditional on political alignment, and must be used to support neutral humanitarian medical care based on need rather than nationality or affiliation. A personal message from Queen Sarith accompanied the official funding announcement. "Dr. Webb, you demonstrated 7 years ago at Taravesh that integrity practiced far from thrones and far from observation matters more than political calculation or performed loyalty. That lesson saved my life then and again when I recognized your name in the field hospital. This funding honors the principle you embody, that medical care should be based on need, not politics. That keeping your word matters even when it costs you professionally. That consistency between stated values and actual choices when those values are tested is the truest measure of character. Thank you for being Marcus Webb. That name carries weight earned through choices made when no one important was watching and when those choices created professional consequences. That kind of integrity deserves support. You didn't remember me, but I remembered you. Not because you treated a queen with exceptional care, but because you treated a wounded civilian with the same care and respect you gave everyone else. That consistency is what trust is built on. With profound respect and gratitude, Queen Sarith. Marcus read the message twice, feeling something complex, gratitude mixed with discomfort at being elevated for choices that had felt simply necessary at the time. He'd made a decision at Taravesh based on principles he believed in. Medical care based on need, keeping your word, refusing to let political calculations override humanitarian necessity. The fact that one of the people he'd saved turned out to be a queen was coincidence. He'd have made the same choice for anyone, but he understood what Queen Sarith was recognizing. Not that he'd saved a queen, but that his principles weren't conditional. That 7 years later, without knowing who she was, he'd given her the same professional care and honest communication he gave everyone. That consistency between stated values and actual choices when those values were tested was apparently rare enough and valuable enough that a queen remembered it years later and funded an entire humanitarian organization to honor it. Months later, when colleagues asked Marcus about the substantial Korathi funding and the personal recognition from Queen Sarith, he'd tell them about Taravesh, about the siege and the choice to accept insurgent terms that let him treat the wounded, about keeping his word even when it created professional problems. I didn't know she was queen, he'd explain. I just knew people were dying, and I could help if I agreed to terms that prioritized medical care over military intelligence. That seemed like an easy choice at the time, save lives versus follow political calculations. I chose to save lives. 7 years later, I gave my name in a field hospital, and she recognized me. Not because I'd treated her specially, but because I'd treated her consistently with everyone else. Apparently, that mattered to her enough that she remembered my name and trusted me immediately when she was critically wounded. The moment when Marcus gave his name in that field tent, when Queen Sarith went still on the operating table recognizing the doctor who'd saved her life years earlier through a choice based on principle rather than politics. That moment became a reminder that integrity practiced consistently creates trust that no amount of formal protocol or calculated performance can replicate. Sometimes a single name, spoken without pride or awareness of its significance, can stop a queen mid-breath and remind her that the most valuable thing anyone can offer is consistency between their stated principles and their actual choices, when those principles are tested under pressure and far from observation. Marcus Webb had given his name not knowing it carried weight earned 7 years earlier. Queen Sarith had recognized that name and trusted it absolutely, because she'd witnessed firsthand that the man who bore it made choices